All right. Hello, everyone. We're going to get started. My name is Dr. Marty Kotler. I want to thank you for attending this webinar on From Compliance to Cash. Just a quick disclaimer before we get going. The information in this webinar is for educational purposes. It's not intended to substitute your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. Every attempt has been made to make certain that the information in this webinar is 100% accurate. However, it's not guaranteed. Let me tell you a little bit about myself before we get started. Again, my name is Dr. Marty Kotler. I'm a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer, certified billing and coding specialist. My area of expertise is in compliance as it relates to billing, coding, documentation, Medicare, durable medical equipment, risk management, medical errors, and HIPAA. And, I consider myself kind of unique. Most doctors are not certified coders. Most certified coders are not doctors, and most doctors are not certified coders. So you'll see during this program how I combine both specialties to make sure you're doing things properly, help you improve productivity, maximize reimbursement, reduce administrative burden, and help you get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. We have a guest speaker joining us today. You're in for a special treat. His name is Dr. John O'Connor. He is a national performance coach, founder of Velocity HP Coaching, 20 years of practice experience with his wonderful wife, Dr. Jessica Horowitz. Very successful practice. I met Dr. O'Connor about 10 years ago. He became a client of Target Coding. That's how it all started. He's a trusted community leader, expert in advanced regenerative modalities, has a successful podcast, and he specializes in helping providers build strong cash practices. Dr. O'Connor, any other opening comments?
You know what? I just wanted to say I was so excited to have the opportunity today to be speaking alongside Dr. Marty, not only as a peer, but as a client. And first off, thank you for letting me join your webinar today. For all of you guys out there, probably one of the biggest things as new practitioners, especially in a booming practice, is compliance. And Marty's company, services, and personal touch, much like he said, he's on both sides. He understands the coaching, rather the coding, and he's also a chiropractor. So it's real time solutions and real talk on both sides. So, Marty, thank you so much, and I look forward to presenting today.
Terrific. Okay, everyone. So I'm going to open up the webinar with a few items. First thing I want to go over with, there's a difference between a cash practice and a cash patient. A cash practice is a healthcare provider that does not accept assignment, is out of network with all health plans, doesn't even take PI or work comp patients. All patients pay in full for all your cash fees. And patients are going to want to get their claim submitted. Even though you're a cash practice, they may want to try and get reimbursed for the services that they pay for. So just a little heads up, if you're submitting the claim on behalf of a cash patient, let's go over box 13 and box 27. Box 13 of the 1500 form, it says, I authorize payment to the undersigned provider. You don't want payment coming to you. Remember, you're an all cash practice. You don't want insurance reimbursement coming to you. So make sure you leave box 13 blank. Don't have the patient sign that. Otherwise, the patient's going to pay you, and then you're going to get paid by the insurance company. That causes administrative burden. Also, box 27 of the 1500 form, do not accept assignment. Check no to box 27. Again, now, for those of you that are, now I know we have a lot of doctors joining us today. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding. So you may be seasoned in practice. You may be brand new. For those of you that are brand new in practice, accept assignment means you are willing to wait for the insurance company to pay you. If you're a cash practice, you don't want payments coming to you. You're going to get paid. You want the checks going to the patient. So box 13, you leave blank. Box 27, you check no. Now, if you're a cash practice, but you have some cash patients, now you're a hybrid practice. And you see these 8 categories, you should see them on your screen. If you are a mix, which most of the doctors we work with have some cash patients, have some Medicare patients, have some PI patients. So what we call this a hybrid practice. And I've categorized it into 8 categories. So if you're a hybrid cash practice with cash patients, every man, woman, and child that walks into your office is going to be placed in one of these 8 categories. Now, if you look at the third one, in-network, there are pros and cons to being in-network, pros and cons to being out of network. I'm not going to tell you to join any health plan. I'm not going to tell you to withdraw from any health plan. That's a business decision you need to make. Now, what's nice about being in network is you'll probably get more new patients. My nephew is just starting out in practice and he needs new patients. So he says, "Hey, Uncle Marty, should I join any plans?" I told him to join every plan. But here's the good news. If you're in network with a plan, after what, 6 visits, 8 visits, the patient is going to reach maximum benefit. You know, chiropractic works very well. Most patients get better quickly. So even if you're in network, after 6 to 8 visits, transition the patient to non-covered services like maintenance care and laser, shockwave, and other services. So these are the 8 categories that we go over. Next, from a compliance standpoint, make sure you have compliant policies and procedures. Even if you're a cash practice with cash patients coming in, you need to document properly. You need to bill patients properly. So have good policies and procedures. Now, in my opinion, there are 3 phases to compliant documentation. Phase 1 is to come up with a treatment plan. You should see it on your screen. Now, this doesn't have to be in one visit. This could be done over a couple of visits. Most of you will do a history and exam on day 1 and maybe day 2 or day 3, or some of our clients wait till day 4 to do the financial report of findings. That's when you'll go over the diagnosis, let the patient know how much they have to pay, how often they have to come in, what services are going to be provided. Now look at that, the treatment plan I equate to the foundation of a house. Look at that house in the bottom right corner. It's crumbling, doesn't have a good foundation. So a treatment plan, now here again, even if you're treating a cash patient, you need to have a treatment plan. Not because I say so, it's part of your standard of care. In every chiropractic scope of practice across the country, there's standards of care. You have to come up with a treatment plan. So in my opinion, those are the 6 things that should be part of a treatment plan. Phase 2 to compliant documentation is the SOAP notes. And your SOAP notes, they're just going to follow whatever you outlined in the treatment plan. And then phase 3 is a reevaluation. This is your opportunity to remeasure your abnormal findings, remeasure whatever you're doing, and then update your treatment plan. So just again, I want to clarify, these are the same requirements from a compliance standpoint, whether it's an insurance patient, in-network, out-of-network, PI patient, Medicare patient, same requirements. Now, let's go over some compliance forms, new patient forms. Brand new cash patient walks in the door, they need to fill out a health history questionnaire. Now, many of you will do Facebook promotions, so you may offer a free exam, or maybe at a health fair, you offer a free exam. Here comes Mrs. Smith. She's filling out your new patient paperwork. It should say chief complaint or reason for the visit. Staff members, if you're listening to this, make sure you read these new patient health history questionnaires before you give it to the doctor. To begin with, your name, address, and phone number should be on every intake piece of paper. Every new patient form should have your name, address, and phone number on it, whether they're cash or insurance. The patient needs to completely fill out every section, every page. Now, when it comes to chief complaint, reason for the visit, you did a promotion. So you know what some patients will write under the chief complaint? Free exam. No, give the form back to the patient. Mrs. Smith, do you have back pain? Do you have neck pain, mid back pain, lower back pain? Oh, I have lower back pain. Mrs. Smith, I'm going to give you the form back. I want you to write on the form in the patient's own writing, lower back pain. Next form, HIPAA form. Cash, insurance, it doesn't matter. You need to have good HIPAA forms. Make sure you review your forms. With our level 3 members, we do a complete form scrubbing. So I was reviewing a doctor's HIPAA form recently, and I saw a lot of dental information in his HIPAA form. So I contacted the doctor, said, "Where'd you get this form?" He said, "Oh, my brother-in-law's a dentist." That's not okay. That's embarrassing. Make sure your HIPAA forms talk about how you're going to be sharing patients' information. Why is that important? In order to get paid, you may need to share information. You may need to share information with other healthcare providers. Many of the doctors we work with have open therapy rooms where doctor goes in and treats patient number 1, or they have a half a wall. Doctor's talking to patient number 1. Patients 2, 3, and 4 could hear what's going on. So from a compliance standpoint, a HIPAA compliance standpoint, you should have something in your HIPAA notice that says something like this: we utilize an open therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room if requested. Mr. Taylor, are you okay being treated in an open room? And he has to circle yes or no. Also, your HIPAA forms, you don't have to give every patient the form. It could be posted in your waiting room. It could be in a picture frame on the wall. Many of the doctors we work with have a television monitor in the waiting room that loops chiropractic messages. Your HIPAA form could be scrolling across the screen. You could laminate one and put it on the coffee table, or you can give every patient one, but they have to sign an acknowledgement that they either had the opportunity to get a copy of your HIPAA form or you actually gave them one. Next, informed consent, consent to treat. Now, this form has nothing to do with billing or coding. This form directly relates to malpractice. Hopefully, none of you were ever involved in a malpractice case, but if you are, this is the first form the attorneys are going to want to see. What did you tell the patient? This is the form that talks about the possible complications to chiropractic care. What did you tell the patient could happen from your treatment? Now, heads up, we're going to be talking about some cash-based services like laser and shockwave. If you have an informed consent form that you gave to a patient, let's say 1 year ago, and 1 month ago, you bought a shockwave unit, you have to update your informed consent to include what the possible complications are from shockwave or laser. So keep your informed.
Marty, can I jump in on that one?
Oh, of course.
So, guys, to that point, we actually separate them because the instrumentation. So, there's a lot of things that could go wrong versus what is in the chiropractic consent to treat. So, I do isolate them. We'll talk more about it when I take the mic. But absolutely, to what he's saying, we definitely get lazy on that. And if you do bring devices on, especially bring on coaching like us, and you bring devices on, that's something that's very important to be following with what Marty's suggesting. Go ahead, Marty. Sorry about that.
Yeah, sure. Feel free to jump in at any time. Yeah, so I'm going to share with you some stories. A lot of we do surveys in our webinars and seminars, and we get feedback from attendees saying we like when you share stories, especially the horror stories. So I was reviewing a doctor's informed consent, and her says we only treat spinal subluxations. Okay, so I contacted the doctor. I said, do you treat shoulder pain, knee problems? She said, sure. I said, well, what happens if you mess up a patient's shoulder? Will your malpractice insurance company cover your costs? It could be tens of thousands of dollars to defend yourself in a malpractice case. So check with your malpractice insurance company to see if the consent to treat or informed consent form is okay with them. Next form is related to the no surprise law. This is the financial care plan form. The federal government calls it a good faith estimate form. And this relates to the no surprise law, which has been around for a while. And the name of this law says it all. You're not allowed to surprise patients with a balance due. You have to tell them how much things are going to cost prior to providing the services, which I would say 99% of you do it. So that's the good news. So this is what we call our good faith estimate form, also known as a financial care plan form. Now, a couple of things. Take a look at your financial care plan form after we're done with this webinar today. Do you have your NPI number on it? Do you have your tax ID number on it? Do you have the diagnosis on it? I've reviewed thousands of financial care plan forms over the past 15 years. Those three things are typically missing. NPI number, tax ID number, diagnosis. Now I know some of you are saying, wait, Dr. Kotler, I don't understand. Why do we need to have our NPI number, tax ID number, and diagnosis? I don't understand. You know what my response is? I don't understand it either, but I don't make the rules. I just explain them and enforce them. The federal government says on your financial care plan forms, you should have your NPI, tax ID, and the diagnosis. Most of you just have what you're going to be doing and the cost. Oh, by the way, all the forms that I'm going to be showing you today come from Target Coding's package of 100 forms, logs, fightback letters, and templates. If you're interested, you can purchase them. Now, the most common cash-based services, in my opinion, in the chiropractic setting include laser, shockwave therapy, and PEMF. Some of you may not be familiar with that. That's pulsed electromagnetic field therapy, PEMF. Now let's go over some more financial forms. Here's a list of the forms that we have put together. You probably don't need all these forms. This is a very long list, but this is just a sampling of the forms that we provide to our clients. Now, before we move forward, a little bit about the Affordable Care Act of 2013. Whether you agree with it or not, this bill mandated that every insurance company in the country have a chiropractic benefit. So I would say 8 out of every 10 patients that walk through your door have insurance, and that insurance is going to have a chiropractic benefit. So you probably can relate to this. Most patients that walk into your office that have insurance and they know there's a chiropractic benefit, they'll just assume that everything you do is covered. So that's where communication is key. And that's why I brought in Dr. O'Connor to go over the communication that the doctors and staff members have to have with patients to get them to understand that not everything is covered. And some of you are good at it. Many doctors are not good at it. Many doctors are faced with objections that patients come up with. Dr. O'Connor is an expert in handling objections, and I think and I hope he's going to be going over some of them today. And also staff. Some staff members, they're just not good at looking patients in the eye and asking them for money. He's going to go over that too. So the Affordable Care Act, just be aware, that mandated that every insurance company has a chiropractic benefit. So to keep things simple, this is a sample walkout receipt. You're a cash practice or you're seeing a cash patient. They get shockwave, an adjustment, laser. You could just give them a walkout statement just like this. Okay, Mrs. Anderson, you've paid for your services. Here's a statement. Good luck. Submit it to your insurance. Hopefully you'll get reimbursed something from them, but you're off the hook, so to speak, doctors. If you're a cash practice or you're seeing a cash patient, you don't have to submit claims. You don't have to wait for payment. Just give the patient a receipt. You know what would be ideal? Patient comes in, gets shockwave, laser, PEMF. They pay, and they don't ask for a receipt. They don't ask for a statement. They don't ask for anything to be submitted to insurance. Now that's the perfect patient. But I would say be prepared. Patients, I mean, you can't blame a patient. If they have insurance, they're probably paying for it, and they probably want to use it to try and recoup the money that they've paid you. You can't blame a patient for that. You know, I think health insurance is the only type of insurance people want to use, right? I don't want to use my life insurance. I don't want to use my car insurance, but health insurance people want to use. So these are all different types of statements. This is for wellness care. I showed you one for Shockwave. We have samples of all of these in our package of forms. Here's, some patients or some offices will say to a patient, okay, we're going to be doing Shockwave, laser, adjustments. Here's our normal fee, Mr. Johnson, but we're going to be giving you a prepaid discount, also known as a prompt pay discount, or a bookkeeping savings discount. So you have to put that on the form too. You can't give the patient a receipt for a fee that they didn't pay. Your statement must reflect whatever the patient paid. So this is an example. An adjustment, $100, discount 25, balance due 75. The patient paid 75, balance 0. So you're being transparent. That's what compliance is about, being transparent and letting patients and insurance companies and everyone see what you're doing. Okay, I'm going to take a break right now. I'm going to let Dr. O'Connor take over.
Marty, thank you so much. So, guys, as Dr. Kotler said, as Marty said, insurance is your foundation, right? It gives you stability, and of course, compliance is there. Cash services are your growth engine. All right, it's innovative, and what we've done with Velocity HP Performance is create communication tracks that start from our coordinators, or what we refer to them. Marty said something that was great. He's talked about transparency, talked about treatment plans, and we call it the 3 T's for transparency, transaction, and the testimonial. And we're transparent with regards to our front desk at any practice that we train are educating the patients on what's covered and what's not covered. Much like what Marty said with regards to health insurance, probably 8 out of 10 patients have insurance, whether we're in network or not. That's a different story and not a topic for today. With what I do with what we call ARM, Advanced Regenerative Modalities, there's nothing that we submit towards insurance. We're very transparent with that with all patients. And that's from our website to social media to our coordinators and even our forms that go out to the patients. When we do that, being transparent establishes trust. There is no guesswork. We do not, they don't get up there and they're surprised. Matter of fact, when they get to the front desk, they're handed a laminated form letting them know if they didn't have a chance to read what was sent to them by the coordinators and the onboarding paperwork, and being able to decipher what's going on. Is it a shoulder issue? Is it elbow? Is it knee? Is it hip? It's also describing what the benefits are of class 4 laser, in simple terms, shockwave therapy, in simple terms, PEMF, and we actually have Core 4. We also utilize cryotherapy with a nitrogen-based system, all of which are cash-based services. With that being said, when the patient comes in and we walk them through that process, that communication is everything in how we target, the prescription. And that's the biggest thing that I see when I'm at events and listening to doctors talk about, we have these machines, but, we're bundling it into care. I'm like, what is this is why we hired Dr. Marty, and he was so amazing because he would always give you the smile that he has right now. Like, well, we can't really do that. And you can't. And that's what we realized. And those conversation tracks, they were very hard. And that's the skill that we develop in each and every one of you practitioners is we show you how to be transparent. We talk about the science. We validate that these modalities are utilized at amazing hospitals like the Mayo Clinic or the Hospital for Special Surgery, or many of the professional teams around the world. With that being said, you're establishing trust outside of a gimmicky thing that could run into it when we talk about, and Marty talked about this earlier with regards to promotions and different things like that. So we want to really make sure that we're creating a global presence of this advanced regenerative modalities, what it is. And then with that education, that makes people want to jump in. Marty talked about a couple of things that I really loved and, talking points. Let's talk about objections. That's probably the biggest thing that I can remember. It was a decade ago now with Marty, and our practice was just chiropractic, physical therapy, and occupational therapy. And it was the beginning of high deductibles and, insurance and co-payments and whatnot. And we struggled with that. And many chiropractors did. And here I was as a practitioner that was one of the top in the state. And we had that hard discussion, from the front desk and back. And what we realized was we needed to establish a clear, and this is actually something Marty taught me, is to not take an insurance, that is going to put us below, as all of us have to do. I don't care whether we're internal medicine or surgery or chiropractic, that we can't stay in business having and participating with or working with. And so that becomes, how well do you communicate? How well do you deliver the message of what your sciences could do? And obviously the results that you get, and how do you get those results out there? Testimonials, what you advertise, and what keys on people looking for relief with shoulder issues, chronic shoulder issues, back pain, those kind of things. And when we can do that, those are the talking points that make people want to spend on these services. Objections come back all the time when I'm speaking with peers, doctors, physical therapists, chiropractors, occupational therapists, even orthos, and they're like, they don't want to pay. And I disagree with them wholeheartedly. People are paying for stretch labs. They're paying for personal trainers at $150 a session, right? Most of you don't charge on this call right now, don't charge $150 for your chiropractic adjustment. The personal trainer is charging $150 for an hour workout. So again, we talk about communication, education, and establishing value that the patient sees, feels, and perceives by the amount of education, communication, and the energy of which you deliver it, so that they're jumping in and they can see the results. And again, that's the process that we teach at Velocity HP Coaching that's really been a game changer. Another neat thing that we talk about, and we're not slighting insurance, it's just the reality is that any practice is seeing declining reimbursements. So once you have a competent insurance department, or if you work with an external billing company, when you know what those benefits are, you really kind of know what you're working with. That's probably the biggest thing that we do, is say, hey, listen, guys, we want you to keep, taking care of the patients that have grown, old with you, with Medicare, et cetera, this and that, and give them great care. But obviously, forms that we learned, like ABNs and this and that, and all the different things that Marty's taught us with regards to what's covered, what's not covered, what they have to pay for. That Medicare discussion really brought me into creating Velocity HP Coaching. It's about being transparent, right? It's about saying, hey, this is what you get with your insurance. This is the full spectrum that we offer. And patients want the speed of recovery. It's our job to offer that to them. To me, if you have a skill or a service or a science and you don't know how to deliver it, that's an unfortunate thing for both the patient as well as you as a practice, because it's affecting your bottom line.
John,
Go
could I
ahead.
chime in for a second?
Yep.
You said the M word, Medicare. So
Yes.
doctors, staff members, you could look at Medicare as the glass half empty or half full. We look at it as the glass half full. When you think about Medicare Part B, we're talking about the red, white, and blue card patients that come in. Medicare Part B are cash patients for everything you do, except for one thing, the spinal manipulation. So let's say your normal fee for an adjustment is $70. In your region, Medicare might pay $45. Okay, so you have to quote unquote compromise your fee for the adjustment. Everything else, exams, x-rays, therapies, vitamins, laser, shockwave, is cash. So look at the Medicare patients, especially those red, white, and blue card patients. When they come in, treat them as if they're cash patients. And not only should you be charging your normal fees, you are required to charge your normal fees. This is what I hear. We get this question at our help desk all the time. Dr. Kotler, we don't charge our Medicare patients for the exam because Medicare doesn't pay for the exam. That's not okay. If you're giving away that exam for free because you want to be a nice guy or you think Medicare doesn't pay for it, that's an inducement. That's not okay. Medicare would frown upon you giving away a free exam and then charging for the adjustment. So whenever I hear the M word, Medicare, my radar goes up. So I just wanted to chime in there for a minute, Doc. You can take the presentation back.
Love it, Marty. And by the way, guys, the same thing. I get excited with my Medicare population. I don't refer them to, as Medicare. I call them super seniors. It's just us, right? It's us in 13, 14 years, or some of you sooner. When I hit my 50s, I realized that the patients that I had and how adorable they were Medicare age. All of a sudden, they didn't have Blue Cross Blue Shield or Cigna or whatever they had. And Marty's exactly right. They had just traditional Medicare. Um, in our education process, they were already aware of it. So we had our exam fee and we had, the chiropractic adjustment, which again, his terminology is on point. And then what we would do is explain to them, these are the services above and beyond. And we go right at it. We weren't worried about electric muscle stim and ultrasound. We actually don't use them in our clinic to confuse what we do here. We've actually eliminated them. We don't hot packs or, we utilize science all the way around. And staying clean and black and white like that, it eliminates a lot of discussion of the patient. Marty touched on something earlier, like right around minute 5 minutes into the conversation, with regards to asking for a bill to be created. For instance, something like PEMF, it does not have a code to our knowledge, right? So we do our best from the coordinator to the email that's sent to them that's what it's going to be. Again, we can't even generate a code for it. So what we do for them is we explain to them what it is, the clinical rationale, the treatment times. Our forms are very clear. So much like what Marty said, as far as, having your NPI tax ID number and the diagnosis on there, we have that for each region and the modality that's being used. When you talk about an average case for an arm patient, again, that's advanced regenerative modalities. In our office, 6 visits is probably around $3,000 that the patient pays, and they pay up front because we schedule on the machines and we only have a limited amount of machines. So essentially, the neat thing about that, and Marty has the perfect terminology for that. And that's why we actually created this, this alliance, is because I want to improve that. Essentially for us, if I'm coaching one of you as a doctor, it just comes down to, our center is a powerhouse, right? We're a teaching center. I work alongside Medry Laser and Technology. I work with Pulse PEMF. I work with all the major players in the market. And so we have 6 shockwaves, we have 4 lasers, we have 5 PEMF units. We have technology coming out the wazoo. But for the average center that we set up, you may have 2 lasers and a shockwave and maybe 1 PEMF unit. So scheduling is everything, because an average cash visit for me, I believe, is $375. I tell every patient, I tell every one of my staff, when you go to a nice dinner, do you want to wait an hour unless you requested it for your main course to come? The answer is probably no. Okay. Do you want to wait for a fork if you're going to eat, or a napkin, or no? Probably not. Well, when you're offering what we consider these centers are these boutique regenerative medicine centers, we're very efficient with that when scheduling, and that's definitely something to talk about. I want to go into the objections, because I think that's probably, one of the biggest things that I see. And let me grab some good questions that we hear. Patients won't pay cash, right? To me, that's the furthest thing from the truth. My background, one of the things that I left out when Marty introduced me, was I'm a professional basketball trainer with the WNBA, NBA, and Europros, as well as scholastic athletes for 20 years. That's what built my practice. Seeing it with parents, and myself as a parent, we'll do anything for our kids. But we'll also, if there's a belief, we'll do anything for ourselves if there's a belief based on science. I always tell people I'm never selling, I'm educating. My entire team is educating. Whoever comes on board and and wants to do a discoveries call, that's probably one of the biggest things you're going to understand, that it's about educating the patient on what this is. And we tell people all the time that when we're creating doctors, look at it like Batman, and he had this amazing belt of all these gadgets of defense and whatever that were just made him amazing. How I describe ARM, advanced regenerative modalities, is your class 4 laser, your focal or radial shockwave, your PEMF, whatever the modalities, your cryotherapy, they're tools on your tool belt. And when people are looking to speed that gap up between injury date and return to life, that's what we offer, right? And one of the things that resonated in Marty's introduction was the fact that what insurance, like, I realized when I started 3 years ago, and I'm 13 states now, is I don't want to be told by a carrier how to treat my patient and what the patient needs. I want to go by how the patient feels, what they look like on imaging, diagnostic, testing, and ultimately if they're back to activity. With that being said, the cash-based systems that we have, we walk through that entire thing. We paint this entire picture. And again, to be fully transparent, we do have physical therapists that are out of network nonetheless, but we have physical therapists and we have cash rates if they don't have that, as well as chiropractors that do participate with insurance. But our advanced regenerative modalities is fully a cash practice. When we talk about healthcare, when we talk as a group, we refer to it as scaffolding. So we're building a care plan. This is something that Marty, and he'll maybe jump in and correct my language, but Medicare kind of requires you to do this. So I took this from Medicare in that Medicare wants to see how you're spending their money, is the way I understood it a decade ago with Marty. And I've always been inspired by the amount of knowledge that he has. But what we do is we call it a wellness budget. So we'll create care plans with how much the visit's going to cost and let them know this is projected what you're going to be spending, and this is the time frame. When patients see that, and it's not guesswork, this bill is going forever. I hate to say it, but there's brother and sister chiropractors that in the day, and I may have been guilty of too, of keeping patients on because there allows 30 visits. Well, the person was fixed in 4. And so that's why I love what we do, because we prescribe care, we get results, we're transparent with what we charge. They know there's never guesswork. Matter of fact, the doctor is showing them there's a balance. They sign off in front of the doctor. They go to the front desk. They make sure, like in our system, that all the consent forms are signed and initialed with the diagnoses on there. And then they're paying and getting a copy of all that paperwork so they have it for their records. That's probably one of the biggest things that I take pride in. And I was always such a good student with Marty with regards to that, is I never want anybody to say they felt like they got duped, or whatever the word is you want to say, is they didn't know and they were blown away. Right.
Yeah, I
Now, I
can
don't know.
chime in a little bit, Doc.
Yep.
Yeah, care plan, plan for care, treatment plan. To me, they're all interchangeable. It is required to do under the scope of practice in every state. And I read a lot of data, and Medicare came out with data on chiropractic documentation, and they found that the treatment plan was missing 83% of the time. So for those of you that have been to my seminars and webinars in the past, you know how I stress the importance of creating a treatment plan. And again, it doesn't have to be all on day one. It could be done over a few visits. So definitely put together a care plan. And Medicare, if you're billing Medicare wants to see a beginning, a middle, and an end. Now, if you get the Medicare patient to maintenance wellness, you don't have to worry about a beginning and a middle and an end. So the key to transitioning patients is to get them to wellness and maintenance as soon as possible, and then you can let your hair down. Back to Medicare patients, we speak to some doctors that say, I'm not in Medicare, so can I see patients if I'm not in Medicare? You're probably going to want to see Medicare patients. If you're not in Medicare, this is how it can go. You have a 64-year-old patient coming in, paying cash, loves you, you love them, and now they turn 65 and they get Medicare, and you're not enrolled in the Medicare program. What are you going to do? What are you going to say? Okay, Mrs. Williams, happy birthday. Now get out of my office. So even our practices that are mostly cash, and I would say 40% of the doctors we work with are mostly cash practices, but they do take Medicare. And back to data and rules and guidelines, I probably spend a third of my work week reviewing guidelines from Medicare, from Aetna, from Cigna, from United Healthcare. I read journals from Medicare malpractice, from chiropractic malpractice insurance companies. I'm constantly contacting state boards. So, and I'm reading, I always refer to the Medicare claims processing manual. Now, I know some of you were saying, I'd rather have root canal than read Medicare guidelines. Well, you know what? We all have strengths and weaknesses. I enjoy it. I like it. I know it sounds strange. I don't find billing and coding and compliance boring. I love what I do. You can probably tell from the passion in my voice. I don't find it boring. So just wanted to chime in a little bit about that.
All right. Well, just to be clear, I do. So that's why we're about 90% cash. But I will say this, Marty's spot on. The reality is that you have to dot your I's and cross your T's when it comes to this. And, it's funny, I had a massive chiropractor in North Jersey in my home state that I just onboarded that was about 3 or 4 million a year in insurance and wanted to bring in a cash vertical. And I actually did an onboarding with them and met the doctors. It was the physical therapist. It was about 6 to 8 of ATCs, PTs, PTAs, and occupational therapists. Each one of them was like, I can't sell this. And, I cringe when people say that word sale. I said, we're not selling, we're educating. Remember, like the one thing for me, my background was that, you guys, if you're not familiar, you should take a look, is my business coaches are Alex Hormozy and Andy Elliott, and then another communication expert. These are conversation tracks. It's about education. It's about inserting education in immediately, and much, to be honest, and these are major practices. And you heard Marty's data point, 83% of Medicare patients don't have treatment plans. 100% of our victories that are won with practices that are seeing, 80 patients a week and increasing their revenue within 45 days by $30,000 to $45,000 a month in cash services are mastering that because they're mastering those care plans. And again, I'm not talking about care plans that are a year long with spinal decompression and laser. I'm talking about, we are musculoskeletal experts. Like Marty said, whether you're just doing adjustments, we are educated to deal with the axial and appendicular skeleton at a very high level of results and intellectual capacity and communication. To me, it's our job to communicate that to the patient and then execute those care plans. So that's probably the biggest thing that we go at and attack, from the coordinators to the treatment doctor. But back to that practice, when they said, and they realized it wasn't sales, it was education, which creates the buy-in, that's when they were super excited. I'm actually starting next Tuesday with them and finishing fourth quarter with them. So again, that's the one thing that we love projecting out there and talk about testimonials, because the two doctors that brought them on with similar practices in Connecticut saw a huge, insurgence. The other thing for us on there, and Dr. Marty and I will say he's done a thorough job. He put me through the ringer and vetted me to make sure I was the guy for this. And I appreciate that. I do the same thing with my podcast guests. And the one thing when we're interrogating practices, I want to know how committed they are to not being uncomfortable talking about financial services, what it's going to cost, and being transparent. When you master that, it is amazing how it changes how you communicate to the patient. You don't shy away from it. And remember, we're the leaders, right? So if there's something that Marty's uncomfortable with, everybody on his team is uncomfortable. So whatever your weakness is, that's what we have to flush out and make that a strength. And again, Marty touched on a lot of points. I'd hate to see the numbers, but Marty knows, like, what do you charge for the exam for Medicare, right? Do they sign those ABNs? What's your number that you establish beyond what they get for the chiropractic adjustment for traditional Medicare plan? This isn't something that we talk about. This is something we know what the rules are. It's black and white. This is what Marty deals with every day. We just are very black and white and say, hey guys, this is what they get. Education starts with the coordinator. It's no different than looking at these grids on the screen. And we move to that flow sheet from the minute they call in, and we're moving them through fast, effective, and clear. Listen, our older population likes to hear us enunciate our words. They like to take that whole 30-minute exam. Make it count. Educate them on the benefits of what you're going to do. And again, when we talk about cash-based services, okay, the value stack is that, most of these patients have been told by their surgeons or their primary care they can't have surgery. Manage the pain. Deal with it. Stop being so active. So when we see these amazing testimonials that we're bringing people back to life, back to activity, those are the rewards beyond. Obviously, it's always nice to get paid for what you do, but it feels really good when you're getting grandparents off to be able to take their kids to a cruise in Alaska or Europe or even Disney World, or just being able to join them and be at graduation. These are things that we do every single day, and it's those testimonials that just keep building our business out.
John, before you continue, just
Good.
want to remind everyone, we will be taking questions and answers. So feel free, a couple of questions have come in. Feel free to type in your questions. We're going to get to all the questions at the end of the presentation. Okay, John, back to you.
Absolutely. And again, so that's it. We have, and again, we're getting into that point to hit these questions. So I'd love to do that. If anybody wants to know exactly how we operate, we move through pretty quickly. We do run an 8-hour boot camp across a month. And what we do is we take a look. If practices, we do a diagnostic. So it's almost like your check engine light. If you have lasers and shockwaves and PMF and you're not producing to the level of what one of our centers would, we take a look. We take a deep dive into how your communication is. Is it just one doctor of the 4 that is prescribing? And all those different factors. And then we build out a plan to make sure that we have an active solution and an active plan to make sure that we're transforming your practice into a highly successful, highly productive, cash-based system. Question-wise, Marty, we can get going. You have yours there. You want to start reading them, or you want me to go through?
Okay, let's take a look. Well, before we get to questions and answers, I want to touch a little bit about, I'm going to talk about credit card surcharges. That's a common question we get. Can we pass on the credit card fees to the patient? I'm going to get to that in a minute. But you know what, Dr. O'Connor, before we move ahead, some people might have to go. We're going to be going till 2 p.m. Eastern, so we're going to be going for another 13 minutes. But if any of you have to go, if you want to get in touch with Dr. O'Connor, right on the screen, you could scan that QR code and you could set up a consultation with him. That's his contact information. So there's the information right there for Dr. O'Connor.
Thank you so much. And guys, if Marty, if I could jump in.
Yeah, go ahead.
We didn't put it on there, guys, but I will tell you this is I would definitely encourage you, if you guys are looking to build a cash vertical, you're frustrated, you're looking for an earning point, we're rapidly growing. And I have to tell you, we have an incentive on there. So when you register with our national outreach doctor, Dr. Tardio, he'll be sending an added incentive of an extra 1 to 2 hours of objection, counter objection, which is a value of about $2,000. So again, like I said, I think you guys would be blown away, and I'd be remiss to tell you guys not to definitely take advantage of this opportunity.
Great. So scan that QR code right on the screen. It should work. And you could set up a meeting to discuss your practice with Dr. O'Connor. And there's no charge. Dr. O'Connor, I think you normally charge like $300 for this free consultation, something like that. I don't know.
So yeah, I mean, initially what we do, so our program rate varies if we have to set them up and they don't have devices, but initially our consultation rate is $500 to do that if they're looking to move forward. This one is completely complimentary as a result of you allowing me to talk to your guests. So of course, thank you so much for that. Yeah, so they're saving $500 to jump on a call because we do a full practice analysis in that 30 minutes. Dr. Tardio sends them an assessment. So we have everything. So I move through it very efficiently rather, to kind of tell them what I see, what I think they need, and what we can do to redirect their program.
Okay. All right. Just a few other closing comments. From a compliance standpoint, prevention is the key. Don't wait for the oil light to flash on your dashboard. Just a couple other things. If those of you that are not familiar with target coding, we offer a lot of different products and services. We have many webinars, live and on demand. You can go to the Target Coding website, targetcoding.com, click on the on-demand page. You'll see we have over 25 different on-demand courses. We call this our library of webinars. We also have a CA bootcamp. We call it our CATS program, our chiropractic assistant training series, 6 classes, excellent for brand new CAs, even CAs that have been in the business for a while. Class number 1, we talk about spinal anatomy, chiropractic terminology, onboarding of new patients. In class number 2, we show CAs how to fill out the 1500 form. There are 33 boxes on the 1500 form. We go through all 33 in detail, and we also go over how to read EOBs. Class number 3, we go over Medicare ABN forms and how to provide prior authorizations. Class number 4, we go over how to show the CAs how to help the doctor do the notes. In class number 5, we go over billing, coding, rehab procedures, time-based coding, unit reporting, and in class number 6, we go over HIPAA and the 7 elements of an effective billing and coding compliance plan. So yes, you should have policies and procedures on billing and coding. It's one of the best ways to get your staff on board. One of the most important things that staff members want is organization. They want to work for a company that's got their act together. So this helps prevent whistleblower action. So we can,
Marty,
yes,
I'm
go ahead.
sorry. We just had Aaron Cox, one of your clients. I just wanted to make sure we get that as we're getting tight on time. So I just wanted to field one of the questions down there, if you didn't mind.
Okay,
All
we'll
right.
get to that in a second. So
Okay.
yes, we should have policies and procedures on cash plans, prepaid plans, and documentation, billing and coding. I also wrote a book. In my opinion, this book should be part of every chiropractic billing library. It's the codes to improve reimbursement, helps prevent insurance denials, reduce administrative burden. It has the best PI cheat sheets in the industry. I mentioned my forms, logs, fight back letters, templates. We offer memberships, 4 levels of membership. Level 1 starts at $99 a month, pay as you go. So we have options to fit every practice, cash practice, Medicare, PI. We have tons of testimonials across the country. Now, credit card surcharges. This is a common question we're getting at our help desk. Is it okay to charge patients the credit card surcharge? And the answer is yes, in most states. I would say 44 out of 50 states allow you to pass the credit card surcharge on to the patient. Now, a couple of things. You must tell the patient in advance you're doing it, and it can't be more than, I think, 3.9%. There's a link at the bottom of this slide where you could learn all about credit card surcharges and which states allow it and which states don't. So please check with all the carriers you bill prior to submitting claims based on this information. We can't guarantee this information. We'll guarantee payment from any insurance company. You know the laws are always changing. Do your best to stay on top of these changes by attending seminars, webinars, join your national and state professional associations. Again, there's Dr. O'Connor's contact information. Here's my contact information, email info@targetcoding.com, website targetcoding.com. Stay in touch with us on social media. Follow us on Facebook, Instagram, LinkedIn, YouTube. I have over 100 free videos on YouTube. Telephone number 1-800-270-7044. We still have doctors that want to fax us information, so we have a HIPAA secure fax number, 1-844-831-2347. If you'd like to set up a free consultation, we normally charge $350 for a practice analysis. You could scan that QR code on the screen, or you can give us a call or send us an email. All right, let's take a look at what questions have come in.
So if you don't mind, I think that it's going to be easier for you to answer those top 2. If I could target Erin for the focus of what she's doing to integrate cash-based services, I would
With
take
Erin. Yeah, let's take
Okay.
Erin.
All right. So, Erin, what I'm seeing there is this is a common thing that we see a lot when we come into coach practices. That has to happen prior to. That's the discussion from the coordinator, letting them know you have the acupuncturist and you have a shockwave practitioner. That's teamwork. We have a system in Velocity HP coaching with them when that new patient comes in and they're requesting acupuncture, but they're looking to do shockwave. It is so much easier that when the coordinator puts it out there and lets them know, it's not competing like insurance and cash practice. They're not competing, they're synergistic. It is all communication. So what I would tell you is you definitely want to jump on, a 30-minute free call. We can work you through that situation. And like I said, that should be synergistic and those doctors are there. The number 2 thing, especially with cash-based services, a lot of times what we see is coming up with any type of a bonus structure for doctors. And we have a couple systems set up in the cash-based system world and it makes it very productive for the doctors to want to take that time and be paying attention. So, Marty, I believe the other two are insurance based.
Yeah, we have a few questions that are coming in. So, question here, can it be the NPI 2 or does it have to be NPI 1 for each provider? So those of you that are in a practice with multiple doctors, I'm assuming this doctor is talking about the good faith estimate financial care plan form I was referring to earlier, NPI number. Keep it simple. Put the group NPI number. You don't have to use, if you have 10 doctors in the office, we don't need 10 individual NPI numbers. Just use the group NPI number. Next question. I am the doctor. Do I have to do the consultations on finances with the patient? Can my staff members do it?
Marty, if you don't mind, I'll take that one.
Okay, good.
I see a huge fall off. I've had both. I've coached both styles of practices. I don't. I'm indifferent to whether it's a chiropractic plan or a cash-based advanced regenerative medicine plan. If you have them trained, yes, you can, right? But again, the object in these situations, my average cash plan is between $3,000 and $6,000, and we're not talking about months. We're talking about 6 visits, 9 visits, 12 visits. So a lot of times, I have the doctors that I'm coaching walk through that. Again, when we talk about key performance indicators, that's hiring somebody, that's adding somebody in. I feel that when you're discussing money, and most people get intimidated with the money situation, just like when Marty said the M of Medicare, but money makes people nervous. So having them in an exam room, doing that consultation, being transparent, and having the doctor invested. Now, again, plastic surgeons step out. The MA comes in. They tell them to go through. They walk through. They sign a thing. They tell them they have, financial payment methods out there if they have to finance it. We handle all of that and kind of walk you through the process. But I do think that's a huge problem in chiropractic physical therapy. We have a huge physical therapist that just joined us that Marty's actually going to be working with. That's a national coach as well. And I really believe the doctor has to know their plans. Again, I'm not diminishing the power of chiropractic and saying those plans are going to be significantly less in cost. But again, my plans are about 3.5 to 5 times more in price when they're going with a PMF, laser, and shockwave package, in addition to chiropractic and physical therapy. So I definitely like the doctor involved on that. Marty, feel free to jump in on that.
Well, I try and keep it simple. Whoever's better at it, in my practice, I did most of the financial consultations. Then I hired Tara. Tara was my best CA ever. I trained her. I said, when a patient comes out to the front desk, I want you to say, okay, Mrs. Jones, Dr. Kotler did an exam, took x-rays. How would you like to take care of that? Cash, check, credit card? That's how I trained her. So one day I'm standing near the front desk and I hear her talking to a patient. And this is how the financial consultation went. She said, Mr. Jones, you got any money on you today? And that wasn't the way I trained her. But you know what I witnessed? Mr. Jones went into his wallet and paid. She was better at it than me. So I let her do all the financial consultations. So that's how I look at it. Whoever's better at it, let that person do it. All right, let's see. It looks like all the other questions are basically people saying thank you, you're welcome, thank you, I appreciate you. I think that was it for the questions. Any other closing comments, Dr. O'Connor?
I think the biggest thing when we talk about the integration of cash is in all those systems. That's really what we're masterful at. So that conversation right there was almost something that we would make a spoof of that would be on Instagram or a TikTok, if you will, because I think that's what Velocity HP coaching really does. And when you talk about big ticket items, I would honestly probably pass out if I walked out and they said how to do that. And if it worked, it would be there. But I do think systems have to be in place. And, Marty is so good at it. And it's almost like he's got that accounting or an accountant type brain that what he talks about is very linear in his steps, and he's methodical. What we make people realize is when we're studying personalities and we come into practices that there is those steps that have to go into all this. And I think that's really what we're masterful at doing. So I think to this point, Marty, first off, thank you for having me on your webinar today. I definitely look forward to working with some of your clients and offering them some insight on their practices and taking advantage of that free 30-minute call. So again, just thank you so much, and thank you for all the viewers that jumped on today.
Thank you for your words of wisdom, Dr. O'Connor. I want to thank everybody for attending. I hope you learned a lot. Take care, everyone. Bye-bye.